Hi, and welcome to the Healthy Built Environment for Health Professionals training series. Today, we will be hearing a presentation from Pam Moore, and Pam will be giving a presentation titled A Traveler's Journey, Transportation and Health. All right, Pam, I'll pass the mic off to you.
Thanks very much. Hi, everybody. So what I hope to talk today about is the health perspective and how transportation and the areas of intersection between transportation and health. So just to give you a really quick overview, today what I'd like to talk about, what is the health perspective, what evidence exists, what is the training for health professionals, and some examples of some cross-portfolio work that I've been involved with. So from a health perspective, we know a couple of things. We know that 1 in 3 in BC are living with a chronic disease, which is consuming over 80% of our budget. We know that 50% of adults, and more surprisingly, 91% of children and youth don't get the recommended levels of physical activity. And we know that at 26%, Canada's childhood obesity rates are among the highest in the world, and that it has almost doubled in the last 25 years. So what does that actually look like? When we talk about chronic disease accounting for the direct healthcare costs, there's a bunch of numbers on the screen here, but the biggest one to really realize is the fact that the direct cost to the Canadian economy is $190 billion, and 68 of that is attributed to treatment, and the remainder is to lost productivity. We know that that it's growing faster than the economic development growth rate. So chronic diseases, the 4 most common risk factors: tobacco use, unhealthy diets, physical activity, and harmful use of alcohol. So where this all crosses over, as you can see by the diagram, we know that all of the 4 main chronic diseases are all impacted by these risk factors. So the question would be, how does planning principles impact health outcomes, chronic disease rates, and risk factors? So here's some of the ways it does. We know that if you improve a neighborhood's walkability, either by providing safe pedestrian infrastructure like sidewalks, bike lanes, you get by only 5%, people will be 32% to be more active in their travel. So they're either going to walk more or bike more. For every hour spent in a car, it's associated with a 6% increase in the odds of being obese. Well, each kilometer that we walk per day is a 5% reduction in the odds of being obese. This becomes fairly significant, especially when you have communities that are sprawled, so they actually do have to drive great distances to get to their work. The longer they're in their car, just imagine what's happening. So people who live in neighborhoods with sidewalks are 47% more likely to be active at least 30 minutes per day, which is the recommended physical activity guidelines. We know transit users are 3 times more likely to meet the daily minimum of recommended physical activity, that's 30 minutes per day. But the real 4 transportation impacts to health are air quality, noise pollution, injury prevention, and active transportation. So if we look at air pollution, which I just find this staggering, if you look at the actual number of people that are killed yearly by outdoor air pollution, 50% of deaths caused by air pollution associated with road transport. 1.6 trillion, or I guess in Canadian dollars, it's, I don't know, 2.4 at this point, premature death by outdoor air pollution. If you look at noise pollution and you start to look at the direct acute effects, we're going to have a reduction in sleep quality and quantity. We're going to get a little more stressed and annoyed. We're going to have some changes in our hearing. But if you start to trend it out, the chronic effects, hypertension, high blood pressure, reduced learning and productivity, the long-term effects, heart disease, and permanent hearing loss. So there's definitely an impact to transportation and obviously noise pollution. Injury prevention. We know that the rate of mortality goes up. The higher the speed, the greater the mortality rates. There is a sort of a, what would I call it? Around local governments across BC, they're really toying with the idea of trying within residential neighborhoods to reduce the speed limit down to 30 kilometers per hour, which of course from our perspective is a pretty good thing as opposed to keeping it at the 50 kilometers an hour. Active transportation. We know that the ability to shift to a healthier behavior by increasing physical activity and decreasing sedentary behavior helps to address the risk factor for chronic diseases. And we also know the earlier the better. The physical environment has a significant impact on whether children walk to and from school. If you don't have sidewalks like the picture here, you don't have perceived safety, parents are much more unlikely to let their children walk to school. So how do health professionals fit in? From a provincial goal number 1 is improve health and wellness. We have across most health authorities, we have a multitude of public health portfolios working at the community level. There's a growing recognition across all sectors, just not health authorities, that partnerships and collaboration with many stakeholders will work to build healthier communities. That if we collectively work together, it'll be that much easier to move something forward. We now have a multitude of resources and training opportunities emerging for health professionals. It's evidenced by this 5-day workshop that we've just put on. So part of the resources that are available to us is the one that's right on the screen right now, the Healthy Built Environment Linkages Toolkit. This is a resource that links community design, planning, and health. It provides a consistent, evidence-based, and expert-informed message to use in communication and discussions around the linkages of the built form to health outcomes. Through this workshop, we've gone through all 5 of the focus areas. Neighborhood design, we're talking now about transportation. We'll be talking about housing, food systems, and natural environments. From this resource, I just want to take you down 1 level more. Within this resource, we have since we're talking about transportation, we'll talk about how this resource actually works. When this resource was developed, there was a real recognition that what we were speaking in the health world was really not being well understood by the planning world, nor was the planning world being very well understood by the health world. So the aim of this resource is to take a common planning principle, like enable mobility for all ages and abilities, and look at what is that health impact. In this case, it's increasing physical activity, walking, perception of safety, and transit use. And the related health outcome is a reduction in unintentional injuries. The intent of this resource was to actually help as a conversation starter so that health professionals would appear credible when they were talking with their local governments. So the ability to actually take evidence and bring it forward to help influence a land use policy, a transportation plan, or whatever it may be with the local government. This resource is absolutely valuable in that work. Another resource that's available is the National Collaborating Center for Healthy Public Policy. They've actually they've got a wealth of resources that are available that link transportation practices or principles to the impact of health. I've just put up 3 of them, but I want to go in a little more depth to one that I think is probably of great benefit to any health professional. It doesn't matter whether you're in BC or across Canada. So National Collaborating Center for Healthy Public Policy came out with policy papers. And each of these 8 healthy public policy papers discuss different engineering techniques and will provide a health perspective. These are valuable resources when talking with local governments about transportation planning. They bring a different voice and perspective to the planning table that is not often heard. I use them quite often myself. The other one that's out there is the 2016 report by the Provincial Health Officer, Perry Kendall. Again, has some great results from some of the injury prevention data that they analyzed. So from our perspective, the health authority world, here we are. So how does this all connect to the work that you do in your health authority? This is the health authority world, made up of different programs and portfolios, all with specific focus areas. All have the potential to impact or be impacted by local government policies and programs. But the question really is, where is that area of commonality? How do health professionals link what they know and what they do to working with local governments to influence policies? And part of the way that they do that is by putting on training workshops, such as what we're part of here, the Traveler's Journey. I just wanted to give you a brief background. So the Traveler's Journey. So evidence linked health professionals to supporting a local government's planning and policies. That's probably started in around 2005. But what was happening across, certainly in BC, that health authorities were doing things differently. Content and level involvement, number of staff, were they doing it off the side of their desk, were they a full-time employee, how was it looking? It was very different across all of our health authorities. Our messaging wasn't consistent, our level of knowledge and expertise was quite different, and our areas of involvement were definitely different. Part of the finding of this, the areas of commonality is this training. So the intent of the journey, of course, is to build content, knowledge, and competencies in those the key concepts of those 5 areas that I showed you: design, transportation, housing, food systems, and natural environments. And getting perspectives from content expert and health professionals. So we've now done the neighborhood design, we're doing transportation, and in the next days we'll be doing the remaining 3. And we're hoping that with interactive case exercises and case studies that we really will get to the point that we will competently and comfortably understand what it is that we want to say to local governments and when to say it. Do you say it in an official community plan, or do you say it at a stakeholders meeting? And how are you going to say it? How are you going to do it? Are you going to give a presentation to council, or are you going to do a written report? It really is we hope that by the end of this that you'll develop quite a competency and be comfortable doing what you're doing. So what I'd like to do now is talk about 2 case studies. Both are smaller communities, but both at a stage of readiness to think outside of the box. Their residents were willing to look at different ideas to improve transportation within their community. The first one is Clearwater BC. It's approximately, just to give you a sense, it's approximately an hour and a half north of Kamloops. It's a small rural community. It was a district that was incorporated in 2007 from the Thompson-Nicola Regional District, which is a huge, huge regional district. Population of just over 2,300 with a 4.8% growth from 2006 to 2011, so it's a growing community, or was. In 2013, the district gained responsibility of maintaining and operating its own roads, what that means is they took on the financial responsibility of maintaining and operating the roads. As you can see, this community is divided by 2 highways, one of which is a trucking route, the Yellowhead Highway. There's 2 commercial areas. There is significant elevation differences. As a matter of fact, what you're looking at, those green lines, are pretty much a hillside. There's a river that runs through it. These are the 2 commercial areas. The larger pink one is where a lot of the commerce is, but the small one on the left has grocery store and some of the amenities. And all around it, the blue is residential. So as you can see, it's somewhat spread out. And predominantly, it's a higher than normal rate of seniors in the community. The picture, oh, sorry. These are the 2 areas that, I apologize, these are the 2 areas that the study, the work that we did was in these 2 areas. So as we go forward, we'll go. So this is Clearwater. There's the 2 highways. As you see, you don't see any people on it, and there's good reason for that. There's no crosswalks. There's no signage. There's no bike lanes. If you look at the islands, if you were in a wheelchair, you're actually not going to be on the islands because there's no curb let-downs. So Now the posted speed here, I believe, is 60 kilometers an hour. It's not always adhered to, and it's most often the speed is in excess of 70 kilometers an hour. Very unlikely that people will walk on the road, even though there's a paved shoulder on either side of the road. It's pretty unlikely that you would feel safe walking on the road. The result is that the ability for anyone to use active transportation from crossing this highway from one side of the residential area over to the other side where the residential and the commercial area is very unlikely. So even though it's small geographically, it doesn't take up a lot of space. In fact, almost all of the residents use their car to get from one side of the road to the other side. So what did we do? We got involved, the Healthy Built Environment team within Interior Health got involved with a Clearwater Crossroads section bylaw. And what it did, the bylaw provided guidelines for the design of roads to accommodate biking, walking, driving, scooters, and shared space. And what we found was that developing and understanding content knowledge is important. So too is the ability to take theory and put it into practice. In this case, we provided context expertise in the form of what healthy transportation was and the planning principles that were linked to health. We also presented to Council on the linkages of transportation planning and health. We took part in a multi-stakeholder planning session to discuss road classifications and specifically what roads or road infrastructure should be included for active transportation. So bike lanes, painted lines on the road, separated bike paths, what should be there. The participants during this were the Council, the Chief Administrative Officer, Ministry of Transportation, Clearwater's own engineer, and the consulting engineer. So we also took part in the public consultation, which I'm going to discuss in the next couple of slides. So when we looked at this, if any of you that are viewing this have ever looked at a road cross-section bylaw, you will know that it is a very, very technical document. It is written from an engineering perspective. It talks about the road being so wide, the curb cuts, curb height being so wide, what the stormwater is going to look like. It's very technical. It's very much an engineering document. The beauty of this bylaw was that it asked and created within the bylaw that every road would have active transportation infrastructure considered, whether it was being built or retrofitted. So no matter what the type of road, you were going to have some form of active transportation on it. It became very important for us, and there's an example, there's the engineering world. It became very important for us to bring the health evidence forward to say why even if this was a local road, you would still want to have active transportation on it. So here's what a very typical in a road cross-section bylaw looks like, but you'll notice that you have a biker and a pedestrian shown. It's, in this case, it's a separated bike path by a planter. You have also a boulevard as well, on either side a green space as well, which is, in this case, it's a drainage swell, so that you have water, instead of going into a stormwater main, will actually be infiltrated back into the ground. It's a marvelous thing. We know from the health evidence that if you can separate active transportation, vulnerable road users, which are the biker and the walker, from cars, you're much more likely to get people out walking and biking. We also got involved in a, what would I call that? A community walkabout. And that was really to help community members understand and get buy-in for creating a new bylaw that would incorporate active transportation. It's one thing to talk about it in theory and say, you know, we will write the document and it will include active transportation on all types of roads, but it's quite a different thing to get people to understand what that means. So through the use of role-playing, our community health facilitator helped people to see how different populations would be impacted by different roads. So the residents were asked to walk down different streets and play the role of a senior with mobility issues, someone in a wheelchair, a young mom with a stroller, and these are the comments that were associated with it. With the road structure the way it was, some of the comments: crossing Highway 5, that's the Yellowhead Highway, is scary. Paths should be separated for walkers and cyclists because you can't hear traffic behind. Mothers with strollers, it's important to have the pathway for pedestrians away from traffic. So all of these people were able to take part. They walked down the different roads that were determined. The community was determined to have changed, and here's the comments that come out of it. So the result of all of this was obviously the cross-section bylaw passed. Clearwater now has a new amenity. It's actually a grocery store that sells fresh food on the highway, and they have a separated bike path leading to that food store. So all in all, it worked quite well. The next one that I wanted to talk about was Vernon's Safe Routes to Schools. The goal of this type of planning is to increase the number of children walking, cycling, taking transit, or carpooling to school. And the plan, what it does is it helps to investigate how children currently travel to and from school, identify barriers, either infrastructure, there's no sidewalks, busy road, kids have to cross a highway, whatever that barrier may be, or is it attitudinal? Parents just don't believe it's safe, or parents themselves are not physically active, or they just think it's not safe. They just think it's too far to walk. They just think it's going to take too much time. So you really need to get the parents, obviously get the parents on board, but you also need to get the school itself. You need some champions. You need kids that can champion. And the beauty of this for a health professional is health factors into this hugely, hugely. We know it's motherhood statements. We know that getting kids walking to and from school is a good thing. We know that starts to shift the health behavior back to a more healthier lifestyle and getting less sedentary behavior. So we, forgive the pun, are actively involved in Safe Routes to School. There are a number of stakeholders that usually come to the table. As I've said before, it's usually the school principal, the champion of the school. It might be the principal or a teacher. It's hopefully a school trustee. It's a member of council. It might be the Ministry of Transportation, the RCMP. Health might be there. You have parents, parent advisory PACs, parents advisory councils, and you have students. Usually the ones that we've been involved with, you'll have pre and post surveys. They're given to the children as well as the parents of the children, and it's asked, do you walk to school? Do you cycle to school? Why don't you? Would you? And then asking, where are the points that you feel uncomfortable? Where's the real problem? There's usually a traffic count associated with it, so just before school starts, between 8 and 8:30 and between 2:30 and 3, all the vehicles are counted. There's a walkabout. You go out and you walk around an established perimeter and you identify all of the barriers. And usually it is traffic speed is too high. There might not be sidewalks. You might have some laps in sidewalks where there's some, it stops, and then the sidewalk continues. Those tend to be the ones, but because you have this multi-stakeholder group, you also have a collective will that wants to find solutions to the barriers. So once all of those things are done, they will start to identify how can you actually get kids more active. Sometimes it's a walking school bus where you have different points on a road, and parents or seniors or somebody will act as the head of the bus. You'll have the kids, and then at the back of the bus you'll have another parent that'll be walking. So it's a very safe, organized walk from a designated pickup point. There might be a number of pickup points along the way to the school, but it's a safe way for kids to walk. You might have, in cases where you have children that have to be driven in, you might have a park, what they call a kiss and ride, so, or a kiss and walk, where parents will drop kids off in an area, and they're again met by a responsible adult, and then they have another walking school bus that takes the kids to school. But the bottom line, the kids start to get routinized to walking or cycling to school as opposed to being driven to school. Usually it will include a lot of education for parents, so that parents are very comfortable that, yeah, even if I'm agreeing to this, my kids will be safe. There's usually some community mobilization and encouragement and celebration. In the case of one of the schools we did, they had a contest to have people, young kids, grade 5s, draw a sign. So instead of the typical traffic sign that says school bus area, it was a kid that had drawn a sign that showed their depiction of slow down, kids playing. So excellent way to get everybody involved. Health is welcomed at the table because it's a voice that we have, a very unbiased voice that says we want to get these kids more active. We know that they need more physical activity in their lives. We know one of the stats is less than 1 in 4 kids nowadays walk to school. Most children 20 years ago got most of their physical activity walking to and from school. So with only 25% doing it, we know we have a lot of opportunity for the remaining 75. And this is some of the examples of, there's the sign that the child won the contest for, and that, instead of on the school zone sign, that's what it says. That's the sign that's posted. So in the case of all of these, this was an infrastructure upgrade where they put sidewalks or they put barriers. In the right-hand corner, you'll see some concrete barriers so that kids walk on the left-hand side and bikes can bike on the right-hand side, but they're obviously separated from traffic. You have separated bike paths in a couple of these pictures. And so as a result of these upgrades, after the post-survey, they saw, quite often you'll see almost up to an 80% increase in kids walking, cycling to school. So it is well worth the effort for a health professional to get involved. There's many different resources across Canada that have questionnaires and surveys, and it's all done for you. So when you have a community that wants to get involved, you don't have to reinvent the wheel. In fact, it's all already available. The site, one of the sites in BC is called Haste BC, and they have all of the resources available to get involved. But it's probably one of the better ones that, from a transportation perspective, if you are going to get involved hands-on, this would probably be the one, because it's almost a win-win all across the board. So in conclusion, we know that in relation to transportation, quite often if you receive a land use referral and it's a transportation plan, it's not hard to make an impact. The evidence is certainly there. And there's different levels of how you can get involved from a transportation plan, providing evidence in a transportation plan that helps support active transportation or improving trails, bike paths, sidewalks, all those things. We've got the health evidence for that. The next step down is sitting at a stakeholder group where you can actually bring that information forward, and that's the point of, part of the point of the Linkages toolkit. The Healthy Built Environment Linkages toolkit is many of those sheets within that toolkit. You can take out, there's some condensed version of all of the evidence that's being found. They're very easy to use, and they're very easy to use at stakeholders groups for community members, councils, whoever is at the group, to really quickly identify, oh, okay, this transportation planning principle, I see how it directly impacts health. So the Linkages toolkit is great. So too is the Collating Centers for Healthy Public Policy. Their 8 policy papers is very compelling evidence in that as well. But no matter what it is, we know that multi-stakeholders and partnerships, as well as collaborations, are key to creating healthier communities. No single partner can do it alone. Local governments are looking for health professionals to help support them. We do bring a very unbiased voice. Biased no, I shouldn't say that. We're biased because all we're talking about is health, but unbiased because there's no vested interest in it except for bringing the health evidence. And we can definitely help support a community to improve or enhance their transportation systems. Thank you very much.